So, a month has passed since I shared this video saying there was no cause for alarm with rising COVID infections across the UK. Now, I explained it would naturally die down in a few weeks. Of course, much of the media likes to cause alarm, and we had NHS doctors calling for the return of free COVID tests and mask mandates. Now, it always irks me when I see the words free COVID tests. They're not free, and the testing so far has cost an absolute fortune, taking money away from other health priorities. Targeting testing, like targeted healthcare, is the way forward. We then saw the editors of the British Medical Journal and the Health Service Journal write to the government calling for more COVID curbs. Embarrassing really, as this was at the point where we were hitting the peak of the current wave. So having said a month ago we would most likely see it naturally die down soon, what has actually happened? Well, many people are tested for COVID as they're admitted to hospital, so this gives us a good picture as to the level of the virus spreading across the community. And we can see here from this chart that identified infections rose for around 4 weeks, peaked, and have started falling again. All this, as with the other countries such as South Africa and Portugal, without the need for further government interventions. You also need to remember, when looking at data on patients in hospital with COVID, around 2/3 in hospital in England with the virus are primarily in for other things, but happen to have tested positive. Despite those who are programmed to call for more restrictions when there are rising infections, the data does show there was no need to panic. And in terms of where we are in the pandemic, the data here on the number of patients in critical care beds in England due to COVID is revealing. It shows how the virus no longer has the upper hand in putting patients seriously ill in hospital. No doubt further waves will come, and no doubt when we get to the autumn the usual suspects will call for more restrictions. I can predict that for sure. Now, as usual, I will keep abreast of the numbers and keep everyone informed.